Can you really diagnose liver disease from your feet? In this video, I go through Dr. Berg's claims and compare them with current medical evidence, separating what is accurate from what is misleading or oversimplified.
Okay, pitting edema. That's where you press your finger into the lower leg and it leaves a dent and it just stays there. That's fluid backup. That's a common liver symptom.
Leg swelling can occur in advanced liver disease, especially cirrhosis, due to reduced albumin production, portal hypertension, and fluid retention. However, pitting edema is much more commonly associated with heart failure, kidney disease, chronic venous insufficiency, or certain medications. Therefore, leg edema alone is not a specific indicator of liver dysfunction.
Then we have fungus, toenail fungus. People with liver problems have a higher level of fungus growing on their body.
There is no strong evidence that liver disease itself causes toenail fungus. The most common risk factors for fungal nail infections are age, diabetes, poor circulation, immune suppression, and prolonged exposure to moist environments.
The nail bed is going to be white. You're going to usually lose that little moon-shaped thing, luna, down here. So it's going to be white because of the poor circulation that's occurring.
White nail beds can be associated with several medical conditions, including liver disease, but they are not simply caused by poor circulation. Nail changes require proper clinical evaluation and are not reliable indicators of liver health on their own.
What really causes liver problems? A lot of things. One big one is the side effect from medications.
Some medications can indeed cause liver injury. However, the most common causes of chronic liver disease worldwide are metabolic dysfunction-associated fatty liver disease, MASLD, excessive alcohol use, viral hepatitis, and metabolic risk factors, such as obesity and type 2 diabetes.
Cooked foods. So if you're just having canned foods, which are pasteurized, and you're not having anything raw, that's eventually going to be very, very hard on the liver and the kidney.
There is currently no scientific evidence that eating cooked foods or avoiding raw foods causes liver or kidney damage. A healthy diet can be based on either cooked or raw foods, provided it contains adequate nutrients, fiber, and minimally processed ingredients.
Protein. So if you're doing massive amounts of protein, it builds up a lot of nitrogen waste. Over time, that can then overload the liver and the kidney.
In healthy individuals, higher protein intake has not been shown to damage the liver. Protein restriction may be necessary in certain advanced liver or kidney conditions, but high-protein diets are generally considered safe for people with normal organ function.